بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today is about presenting some cases in musculoskeletal radiology and try to concentrate on some knee cases. Here, as we see, knee X-ray for a patient with AB and lateral views. As we see here, soft tissue density around the knee is increased and the epiphyses are large with some osteoporosis. And this patient has hemophilic arthropathy and also we see intercondylar notch is increased or enlarged associated with joint effusion here. So this is a classic case of hemophilic arthropathy. Here, this is the sagittal fat-sat MRI. As we see here, the posterior cruciate ligament, and here looks like another posterior cruciate ligament, and we call this sign, this is double posterior cruciate ligament sign in knee patient, and this is classic sign of bucket handle tear of the meniscus, and it is involved about 80% of medial meniscus. So this is the double posterior cruciate ligament sign consistent with bucket handle tear of the meniscus. Here we see sagittal fat-sat MRI image, and we see here the ciliary stalk sign, and this sign describes the anterior cruciate ligament undergoes mucoid degeneration, and we see the fibers are separated by higher signal mucinous material simulating the appearance of ciliary, and it should be differentiated from the anterior cruciate ligament tear, whereas the disrupted of the low signal fibers. So this is a ciliary stalk sign due to mucoid degeneration of the anterior cruciate ligament. And here we see a prepatellar bursitis. Here, this is another sagittal T2 fat-sat image, and we see the patient with Hoffa's fat bad impingement syndrome. And here, this is a tunnel view of the knee joint, and we see this is the intercondylar notch, and we see loose body in the intercondyle notch seen here. Here we see a coronal image of both knees together, and we see bilateral increase density of the distal femoral diaphysis and above tibial metadiaphysis, and almost more or less symmetrical. And there are a lot of differential diagnoses, and the case is here. This is Erdheim Chester disease, and this is one of the skeletal manifestation of that disease, and it is non-Langerhans cell histocytosis, and it is involved the symmetrical sclerosis of the bone. If we do bone scan for this patient, it will be increased uptake of the bone in the bone scan. So this is more or less typical of Erdheim Chester disease, non-Langerhans histocytosis. Here, this patient with osteoarthritis, and we see multiple loose bodies and synovial chondromatosis, multiple loose bodies involving the knee joint, and with also meniscal calcification here. And these are the loose bodies taken after the operation. Here, another patient with osteoarthritis, also with multiple loose bodies seen. Here we see multiple knee joint AB view for both knee joint. We see calcification involving of the muscles of the around the knee due to cysticercosis. Here we see knee joint AB and lateral view in a female patient with dermatomyositis, as we see extensive soft tissue calcification around the knee. Here the child patient, as we see the epiphysis here, and we see patient with aggressive bone lesion with some periosteal reaction and soft tissue swelling with destruction of the metadiaphysis of the distal femur consistent with osteosarcoma. Here we see patient with calcification in the meniscus, and the meniscus here, and meniscus here, and also in the hyaline articular cartilage. This patient with chondrocalcinosis due to CPBD. Here, AB knee joint, we see bone is osteoporosed, and we see almost total loss of the joint space between the femur and the tibia, and this is the case of long-standing rheumatoid arthritis. Here, patient with osteoarthritis, and we see the medial compartment of the knee joint is narrowed with some sclerosis, osteophytosis, and with minimal deformity. And we see here also the chondrocalcinosis with calcification of the meniscus. Here, this is the same patient with patellofemoral osteoarthritic changes with subluxation of the patella. Here there is a calcification of the medial collateral ligament due to chronic injury, and this is called Pellegrini-Steinda sign. Here we see the patella is low in position, and we call this condition patella baja. Here we see the patella is high in position due to patellofemoral pathology, and we call this condition patella alta. Here we see patient with osteochondral disease, and we see here the disease involving lateral aspect of medial femoral condyle, as we see here, and it is still attached to the bone, not causing losing body. Here we see this is a classic example with discoid meniscus, and we see the meniscus in more than 3 sagittal cuts. Here this is a classic example of bipartite patella, and we see this is the bipartite patella in the AB view and the skyline view, and should not be confused with patellar fracture. Here another patient with bipartite patella and with joint effusion. Here we have secant fracture or secant sign. This small tibial avulsion fracture indicate a anterior cruciate ligament tear. Here we have anterior dislocation of the knee, and the anterior dislocation involve about 31%, while the posterior dislocation is involving about 25%. Here, patient with posterior dislocation of the knee. The AB of the patient with posterior dislocation of the knee. Here we see bone lesion involving the metaphysis of the upper tibia with multiloculated with no zone of transition and expansile with septation, and this is a classic, most likely representing the aneurysmal bone cyst. And it is aneurysmal bone cyst. Here, this patient, we have zebra stride sign, and this occur in children in patient with osteogenesis imperfecta treated with cyclical biphosphonate therapy. And this case from the Radiopedia. And another patient with Pellegrini-Steinda calcification or lesion. This is due to chronic injury to the medial collateral ligament with calcification, with avulsion injury. Here, this is a patient with symptomatic osteochondroma of the upper tibia. Here, this is a patient with T1 and T2 images, T1 and T2 images, sagittal view. We see here low signal intensity in the distal femur on T1 and T2, lobulated, and this is a bony island or inostosis involving the distal femur. Thank you very much for listening. Hoping to see you in another talk.